Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time.
Hello, my name is Samantha Hamilton. I am the Director of Growth and Partnerships with the Institute for Functional Nursing. And today I have Tabetha here, and she's going to be telling us a little bit about herself and her journey as a functional nurse. And she's just going to tell us about how she found functional medicine and how she found our program. And Tabetha is a registered nurse, and she currently is working in home care in rural Alberta, Canada. She lives on a couple of acres with a handful of chickens, ducks, and her husband. She has 2 children with a third on the way, and she's currently homeschooling her children. They volunteer at church and in the community, and she enjoys sewing and gardening. So, Tabetha, if you could just kind of go ahead and tell me what really brought you to functional medicine. I'd love to hear your story.
Yeah, thanks, Samantha. So I've been working in nursing for 15 years, kind of in a variety of settings. Never really had the intention to do anything out of the norm, I guess. You just you graduate from school, you go work wherever. I was never really interested in the hospital. So I've always had like a community care kind of focus, working in different home care or public health settings. But I think things really started to shift for me during the pandemic time, which I think that was a big time for a lot of my peers and colleagues too, just feeling really burnt out, feeling kind of just depressed about the system and things that were happening, and just looking for other options, like what else is out there for nurses. I think I found the podcast, the Functional Nurse Podcast, was one of the first things that really introduced me to the idea of that, which I think is so cool. I'm so excited to be on.
You're welcome. Welcome.
Yeah, thank you. So I definitely have heard a lot of the stories from other people, and it was just really encouraging. And so then it just kind of started me on the path of looking for like what kind of education I could take to learn more about it. And yeah, that's kind of the start.
That's awesome. And there's honestly, I hear so many students who are talking about the fact that they just no longer feel aligned in our current healthcare model. And oftentimes they feel really isolated and lonely because a lot of times when you're working at the bedside, whether that's inpatient, ER, ICU, there isn't that many people who are thinking outside the box and really trying to look ahead of where they are. How did your client or your patient end up in this position? How did they get in this bed? And so I really think that like finding our functional nursing community is really supportive for those people who are feeling really isolated. I know you said that you found our podcast, and what really like made you make the decision that you were ready to continue your functional nursing education?
Yeah, I was really excited to learn anything I could. And so I think I just started pouring into like what things are out there. At the time that I was looking, this was a couple of years ago, so the Institute for Functional Nursing did not exist yet, but I think Bridget had started to talk about it a little bit, and like things were coming down the pipeline. So I was kind of just like, well, let's watch and wait and see what happens with this program. This might feel more, aligned to what I want to do. And so I think yeah, that's when I kind of discovered that.
Very nice. And so right now you said that you're working in home care.
Mm-hmm.
Do
Yeah.
you feel that you're really incorporating anything that you're learning in the program now into your current role?
Yeah, a little bit. I definitely feel like I'm looking at patient stories different than I was before, which is really fun. I don't feel like in my current setting I have a lot of time to dive into things like I would like to if I was working in my own practice or, a different kind of setting, especially talking about like the lab work and different things. I just feel like I'm looking at those things a lot differently for people, realizing that normal looking labs are not necessarily like optimal health things, and just seeing that in the context of the person's symptoms and what they're experiencing has been really neat for me.
And so when you're working with these clients in the home care environment, are you providing them education about things related to nutrition and lifestyle, or how does that like fit into your current role?
Yeah, there's definitely lots of opportunity for education in those settings. I work mostly with seniors, but we do have some younger clients as well. So it kind of varies depending on each population, but there's definitely opportunities for nutrition. A lot of my clients are dealing with more complex conditions like a fairly advanced diabetes or heart failure, things like that. But I've definitely found there's nutrition practices that they can incorporate to just feel better, even if it's not about getting them off their medication or making those big changes. It's still maybe helping them sleep a little bit better at night or just, yeah, have a little bit more energy during the day and balance those things out. So that's been really fun.
Yeah, and I think something that a lot of people don't really take into consideration is that even when people have these really chronic diseases that are far advanced, we can even help with quality of life with things like talking about sleep hygiene. We can talk with them even about how the order in which you eat your food impacts how your glucose spikes and how your insulin spikes. And even like talking with clients, educating them about glucose and insulin and how does this impact even, your sleep. Say someone's having spikes and dips during the night because they're eating, ice cream before bed. There's just so many things that you can do as an educator for your clients when you are learning functional medicine. And it's so enlightening to know that we can help in a variety of ways.
Yeah. And like pain management too. Like there's lots of improvements people can make with pain management or like wound healing. Yeah. So many different areas. It's very cool.
What's the favorite, like, kind of way that you've implemented functional nursing with your clients?
I think it's in the blood sugar balance with like sleeping and the timing of snacks and stuff at night. That's been just such an easy thing for me to suggest to people. And it's often something that they don't really see associated with their sleep.
For
Uh,
sure. When you are finished with your functional nursing course, you're in the first cohort of the functional nursing program right now, right?
right.
What is your plan for the future? How do you plan to incorporate this information and education into your career?
Yeah, I love to keep working in the community as much as I possibly can. And I just feel really passionate about bringing functional health to smaller communities. So the town that I work in is about 2,000 people. So we're really little. And I mean, we have difficulty even like retaining regular physicians. It's kind of an ongoing struggle. So a lot of people don't even really have like a primary care provider. We've struggled with being able to keep our hospital open. Things are functioning well right now, but it's challenging in rural areas. And then the nearest city to me is about 68,000 people. And so there just is not really a lot of functional medicine options that are around. So people are driving super long distances to bigger centers where they can get that kind of care, which I think is great to have that option. And people in rural areas are used to driving that kind of stuff. But I do think that as nurses, we are able to do so much even without being able to prescribe or order those tests. And so I just feel really excited about figuring out a way that I can bring that to our local area in some way, either by, telehealth or being in a clinic or something. I don't really know yet, but definitely I've got wheels spinning about different ways that I can make that work and hopefully serve the community well here.
That's amazing. And do you have an ideal population that you would like to work with, or what, like, niche do you enjoy working with?
Yeah, I think I really love women's health. From the time that I was in school, I actually wanted to take a bridging program into midwifery. That was kind of my goal right when I went into nursing, but life happened and, marriage happened and kids, and it just did not feel like the right path for me anymore. And so that never happened, but I love that population. I love working with women, families. I think there's a huge lack of good information about nutrition and stuff, even in prenatal care or postnatal care and all those kind of things. So I definitely feel like I will have to have a niche somewhere in that realm of things. I
Yeah.
also just think, we're getting better with women's health and identifying different problems that women are experiencing, but still, even in my own personal health story, a lot of the things that I was experiencing with trouble with menstrual cycles and stuff were just constantly being dismissed by my PCP and, just being called normal when it's like, well, it might be common, but it's not good and it's not optimal. So definitely there's opportunity there, I think, for better care.
You had mentioned that you are interested in that prenatal area of care, really helping women to prep their body for conception. And I'd love to just hear more kind of about your own health story and what brought you to functional medicine. Most people find functional medicine because they're looking for something that they aren't getting in the current medical model of care.
Yeah, so my oldest child is 12 this year. So we did not have any trouble when we wanted to have children originally. We had him with no issues. We were trying for a second baby, a couple years after, and ended up having a loss, which was really hard to deal with, and then just had a lot of difficulty getting pregnant again. At that time, I was referred, I believe, to a specialist, and we kind of started the process of going through some blood work and stuff for preliminary tests. But at least here, the clinic that was doing the fertility work was more focused on IVF. And so even as we started, I was kind of hesitant because I didn't really feel like that was the route that I wanted to go, even if that's kind of where things were leading and pointing to. But partway through us getting referred there and starting the work of those lab tests, we actually conceived naturally and had my daughter. So that was
That's
wonderful.
amazing.
Yeah, it's such a miracle. Honestly, it was a miracle to me. But yeah, we're so thankful to have our kids for sure. And it was a great birth experience. I had a midwife that time and I had a home birth. Everything was really natural and kind of what I envisioned like the perfect birth to be. It just felt so good and was very redeeming because I think a lot of people have that story where their first birth is really traumatic or you struggle with different things afterwards and it's really really challenging, but the second time did not feel like that. So it was really cool. And I do think a lot of that comes from having more of a holistic care provider to be able to guide through. I don't even really remember it being nutrition focused, but just more like birth intervention focused, where there was more of you had a little more autonomy and decision making with how you wanted things to look with your care and just overall more relaxed. And, your mental health contributes so much to your physical health too. And I think that was just a big part of it. Just feeling more comfortable and relaxed with the provider made a big difference. And then yeah, we decided that we would like to grow our family again and again had trouble conceiving over lots of years. And it took a long, long time to kind of come to terms with the fact that maybe this was just going to be our family size and, there wasn't going to be a whole lot we were going to do about it because we didn't want to pursue fertility treatments or things like that. But it definitely set me on a path of looking into our life, like what could possibly be causing it? Is it something in the environment? We've always kind of been interested in like natural care products and stuff like that, but there was definitely more of a switch of like, let's cut out the fragrances, let's cut out this extra stuff that we don't need and just see if it helps. And so we were making a lot of those kind of natural swaps and switches and things like that. And I think there was just a lot of life stress going on too. We had moved a couple of times and different jobs and the pandemic
Yeah.
and, all the
Yeah.
things. So definitely played into it too. But yeah, just went a long period of years thinking that probably that's going to be our family size. And then recently we got news over Christmas that I was expecting again. So very excitedly, we are having our third baby this September. I I mean, I can't vouch for that it's anything we specifically did to cut out products or things like that, but I think I've just discovered along the way that there's a lot more that can be done and looked at. I've always had menstrual cycle issues, whether it be like really severe cramps or heavy bleeding, things like that, that just kept being dismissed as being normal or common. And, there's nothing really you can do about it but go on the birth control pills. So it's just been really empowering to me that there's other forms of healthcare out there where we can look at those symptoms and say, even if we can improve your fertility, we can improve those symptoms. Like that's a sign that there's something else going on. And even with some dietary changes and things, I noticed better better symptoms than I was having. So that's really
That's
cool.
amazing. And right now we're in the first cohort, semester 1. I'm enrolled in the cohort as well. And we're learning in our environmental module right now and environmental exposures. And I think it's just very timely, really talking about how there's so many things that we and our body is exposed to in our environment. And you don't typically think about everything that you're putting on your body, even just like thinking about what you're eating. Is there BPA in the container that you're putting your food in? Are you microwaving plastic? And these are all things that, unless you are intentional about it, you don't really think about it, right? Or even like scented candles or scented hand soaps and how it can impact your hormones. And so someday when you're working with moms who are working on conceiving, you'll be able to kind of share your journey with them and then how these are the things that really have been able to help you. So, my next
Mhm.
question for you is what's been your favorite part so far about the functional nursing program?
That's a tough question because I feel like every time there's a new module, I think to myself, oh, this is my favorite one so far. So right now it is that environmental health piece because it's so interesting. But I feel like overall, the cardiometabolic was probably the one that had me thinking the most about stuff that I had never thought of before, things that were connected. So that was really interesting.
Yeah, that's
Yeah.
definitely an interesting module because there's so many parts of it that, like, most people, your general population, if you were to tell them that their blood sugar actually impacts their cardiovascular system, they'd be like, "What are you talking about?" And that's something that's so
Yeah.
cool about functional nursing and functional medicine is that all of the different areas, all of the things are connected, and we're really learning about how does your diet impact your cardiovascular health and things other than just like don't eat too much bacon grease, but like talking about our blood sugars and how that impacts our health as well. It's really just, it's very fascinating. So, one of the things that our students gain access to when they're in the functional nursing program is they get access to our functional nursing membership, which is basically like a community of other nurses who are doing functional nursing. And we have 4 time a month live calls. And on these live calls, we cover things from student led case studies, faculty led case studies, and sometimes just open discussion. Tabitha, can you just tell me, like, what are your experiences with our functional nursing membership?
And now, a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real time learning, the functional nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
Yeah, it's been really exciting to be on those calls. I've only been able to log on to a couple of them, but it's nice that they're always recorded. So I've gone back and watched quite a few as well. But I was in one of the more recent ones was going over the elimination diet after we had wrapped up that module. And so it was really good because I think a lot of us had similar questions about how to implement it and how to introduce foods back in. And so there was really good discussion about that, which was really neat. And I think it's just really helpful in this space of nurses, a lot of whom are kind of breaking the norm or going for something that their peers or colleagues are not aware of or interested in right now. It's really nice to have that community piece where there are so many other nurses out there who feel the way that we do and are just seeking more alignment or seeking more holistic ways to bring care into their everyday practices. So I think it's just really encouraging. People are at all stages of journeys. It seems like there are a lot of people who have their own businesses already, which is really encouraging. And then there's a lot of people like me who are kind of new to that idea and the entrepreneurship part of it. But it's just been a really cool source of encouragement for me to see all the enthusiasm and all the ideas and stuff that people are already implementing.
Yeah, it's really cool to see like the range of experience that's in the group as well. Like you were saying, we have some people who are brand new to functional nursing and just learning it. And then we have some people who have been doing this for a while and maybe they have like a well-established practice of their own. Something that I love is that we have our faculty members who are in those live calls, and they're also involved in our membership, like the community. If someone has a question about something that's happening in one of the modules, we can just type up a question and a faculty member will respond back to it. Or I know myself, I've like uploaded podcast episodes on there just on the main feed where I'm like, hey, I listened to this. I found it really beneficial if anybody else wants to listen to it. And that's something that I love about our program too, is that we have an app that you can do the learning through. Oftentimes, if I'm driving somewhere or I'm walking outside, I'll be listening or re listening to the lectures. Do you find yourself doing that as well?
Yeah, and there's so many resources listed after each one of like more learning. I just need more time in my life to be able to dive into all of that because there's so much good information there.
And part of the benefit is too is that like with our program you get access to the content for life. So, I've had instances with clients where I'm like, I remember something about this, but I need to like touch back up on it. Like for example, the phases of detoxification, where I'm like, what happens in phase 2 again and what do I need to optimize? And so I really love that we can just kind of like hop back into the program and see whatever we need to. Yeah. So how do you
Mhm.
feel like you've been enjoying the program so far and the learning? How do you primarily do the learning? Are you on a computer? Are you on your cell phone?
Yeah, I'm loving the program. I do not have any regrets about doing it at all. I definitely am so glad that I was able to sign up for it. And I'm doing it on my laptop mostly and taking notes on a Google Drive. We had a long discussion, I think, on the chat in the community about how people are taking notes. And normally I am a paper person, but I just find it's easier for me with the volume of information to type, and I can take screenshots of the slides when there's like a lot of information or a picture that I really want to remember. And that's been really helpful for me. And it also just lets me focus. I have listened in to just the listening while driving or something, but I feel like it's just so much information that I would have to listen to it so many times to take it in. So I rather kind of just carve out a little chunk of my evening and do a little bit here and there. And it's been so meaningful and so helpful. Yeah, really great.
We have actually a decent amount of students who are like, I am from the like physical book with a notebook, writing things down, highlighting in the book, who are almost like intimidated to be doing online learning. I've kind of been around online learning for most of my career. For me, it was pretty easy to pick up on this, switching into going to using a Google Doc, or for myself, use OneNote for taking notes. And that's kind of the benefit of our community, is that someone has a question like, hey, how are you guys all facilitating this learning? How are you absorbing it? And everyone just kind of chimes in on what's working for them. So do you have plans on starting your own practice when you're done with the program to help moms, or what's kind of your goal down the road?
Yeah, I think eventually I would definitely love to be doing that. I've had some other kind of entrepreneurial experience with little hobby businesses and stuff in the past, and really enjoyed the freedom of being able to be self-employed. So if there's a time in my future where I can sacrifice a little bit of the stability for the freedom of being self-employed, I definitely would love to start my own business. I have looked into a lot of the aspects of like legalities and stuff. It doesn't feel super overwhelming for me. I know it's different for everybody depending where you live, but I live in Alberta in Canada, and I actually have a couple of friends now that are self-employed nurses, and they've said that from what they've talked to other people about, Alberta is one of the easier places to do it with our registration body. They even provide some direction on kind of how to get started and what things you need to look into before you can have your own business. So that aspect has been really interesting. Even if I don't go that route right away, I've learned so much about it, and I don't know. Maybe I'm a business nerd, but I find that stuff really interesting. So
Yeah.
it's been fun to learn.
A lot of nurses don't know that they can start a business. Like that's not
Mhm.
something we're typically taught in school, is that as an RN you can start your own practice. And so really just kind of like being around other people who are doing this, I feel like it's so encouraging as well. So my question for you is we do have a fair amount of potential students that I talk to that are from Canada. And one of their questions for me is always about how you guys have a different healthcare system model and why would somebody want to pay out of pocket to work with a functional nurse? What are your thoughts on that?
Yeah. I mean, I'm probably going to struggle with that a little bit too if I get to that stage. But ultimately, in my friends and family circle, I do know a lot of people who are already paying out of pocket for the healthcare that they want. We do have a public system that covers emergency visits, hospital visits, your regular primary care, your lab work, all those kind of things are covered. But a functional nurse isn't looking to replace your primary healthcare provider anyways. So I think that maintaining that relationship between those people is still really key to providing good care. But ultimately, people are going to naturopaths or doctors of Chinese medicine or different nutritionists or hormone coaches and paying out of pocket for it. So ultimately, I'm not too worried about it because I feel like the people that really want that service already know that they're going to have to pay for it out of pocket. It'll just be a matter of kind of finding those right people for you.
Yeah, definitely. The challenges is that, like, even here in the States, our providers don't have the time to sit down, really get to know a client. What does your everyday lifestyle look like? What does your diet look like? And have those conversations about how we can optimize those things to achieve wellness versus preventing disease. And I really think that there's a difference between achieving wellness and preventing disease. And do you have any thoughts on really just aiming for wellness versus disease prevention or even just disease reversal?
Yeah, for sure. I mean, I don't live with any chronic health conditions either, and so that's maybe never been an area that I feel really personally attached to, but I think there's so much opportunity out there for just improving your life now. And I know we talked about like longevity and different things like that. And I think people are just pursuing health in different ways. They're looking ahead to the future and saying, I want to be able to do the things I enjoy for a really long time. And so, how can I keep doing what I'm doing? So, I think that's really the goal of wellness is, even if you're feeling well right now, it's pretty hard to do that in a world that's full of, pollution and our food sources are kind of not the best and, access to those things our medications, all those sort of things are kind of just contributing to a general downslide in health. So I think that maybe unfortunately it's something we have to be really mindful of, but also it's possible for us to provide a lot of help to people who are feeling well right now and just want to continue that.
Yeah, and I think too that there's such a gap, I want to say almost, where you have those individuals who they're not feeling good, but their labs are normal. They don't have any chronic disease, but they know they don't feel good and they know that they need to do something. And I think that's where functional nursing really shines because these people they don't have a billable chronic disease, they don't have those abnormal labs per the western medicine standard, but we can really look at their labs and help them understand them from an optimal point of view and try and help optimize their lifestyle, their diet to help move them more on that wellness spectrum to help them starting to feel better with things as simple as eating hygiene and sleeping hygiene. Do you have any final thoughts?
I would just love to encourage anybody who's sitting on the fence for the program that it is definitely well worth your time and your money. I looked at a lot of different programs out there before I chose this one. I even kind of considered like, is nursing really the direction that I want to stay, or should I look into other qualifications or, nurse practitioner? But ultimately, I'm just so glad that I kept this path. I think for any registered nurses out there, it's a lot of information. You won't be missing out on anything. There's tons of good information that you can take away to even your current job. Yeah, I just think it's well worth it for sure to learn these things.
I think we have a lot of students who kind of struggle between that like place of do I go back to school as an NP? Do I move to a different career path in general? And I feel like from what I've heard is that most nurses either figure out nope, I don't need to go to school as an NP. I'm learning everything that I wanted to know. I found what I was looking for. Or we have the people who are like, yes, I want to go back to school as an NP because I want to open, my own practice as a nurse practitioner.
Mhm.
And so I think, even for myself, like I knew I didn't want to go for NP, but I knew I wanted more of that, like pathology, the knowledge of how to keep the body well, knowledge about supplements and labs, and even just looking from that like optimal lab range at someone's labs from their PCP can be
Mhm.
just so insightful as to what's going on and providing education to our patients so that they can make informed health decisions moving forward. I think it's just such a gift to be able to provide to clients and to have that weight off of, your shoulders of like, okay, I don't need to go back to school to make an impact with clients really and help
Yeah.
improve people's health.
Yeah, for sure. It really made me feel like I felt when I first started nursing school that I had all these ideas about how things could be better. And I love that. It just is so inspiring.
It really gets the wheels turning where you're like, "Oh my gosh, I can think of, so many people who have experienced like infertility or who have needed to go with IVF, and you can really help them by talking about environmental exposures and blood sugar regulation. And these are things that they're not getting at their provider's office, and it might just be what they need to be able to conceive. And so it really is just a beautiful thing that we can provide our clients with so much information that can be helpful. I think so many students or potential students are going to resonate with this because the amount of people who I talk to that are feeling isolated or burnt out or even just like wanting to help moms or people who want to be moms. Like there's so many nurses out there who I think as some of our female nurses want to advocate for our health, especially like when we're stressed from nursing school and working during a pandemic and just how do we help each other? I wish you the best and I'll see you
Thank
inside the
you.
functional nurse community.
Yeah, awesome. Thanks so much, Samantha.
You're welcome and thank you. Have a good rest of your day.
Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.